everyone. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to speak about a neck injury known as a cervical sprain strain. The cervical spine is the medical name for the neck. A strain is an injury to a muscle, and a sprain is an injury to a ligament. There are numerous muscles in the neck that can be injured. These muscles, what their function is to move the head and the neck and support the head and the neck. The ligaments, they attach bone to bone and provide stability. A cervical sprain strain can be a sports injury, it can be a work injury, it can be from a trauma, or it can have a non-traumatic onset. In the non-traumatic onset, usually it is due from overuse or repetitive motion, and the symptoms are insidious, meaning that they start very slowly and build up. When there is a traumatic onset, usually those symptoms begin abruptly. The most common symptoms of a cervical sprain strain injury are pain, which is often described as sore, stiff, achy, and tight. There's also a great deal of tenderness in the neck muscles and the surrounding tissues. There can be a greatly reduced pain-free range of motion due to the pain and tightness in the muscles. There can also be symptoms that refer pain to the head. There can be jaw pain, there can be shoulder pain, mid-back pain. Many times when there is a cervical sprain strain, you may feel symptoms in the head, in the neck, in the jaw, in the shoulders, sometimes even pain that is referred into the arms and pain that is referred into the mid-back. Now, it is not a sharp shooting shock-like pain, which is usually a nerve impingement type of condition. These symptoms are more of your achiness, tightness, muscle soreness type of symptoms. In most cases, the pain and symptoms of a cervical sprain strain are worse in the morning upon arising. Then once you start moving around a little bit, the symptoms may dissipate, but then the symptoms increase again later in the day as the muscles start to fatigue. Therefore, the symptoms are usually worse in the mornings and worse later in the day in a cervical sprain strain. The pain-free range of motion in a cervical sprain strain can be limited in all directions or just one or several directions. It all depends on which muscles and ligaments are injured and how severely that they are injured. If the source of your cervical sprain strain is a trauma, seek professional care immediately. Do not hesitate. You want to rule out a more serious pathology than a cervical sprain strain. You want to get an evaluation. This may include an examination and imaging. This will help to rule out if there are any fractures or dislocations. If the symptoms begin insidiously, there are several things that you could do. First of all, do not hesitate to seek professional care. This can be an issue that is a more serious pathology than you believe. So you want to seek professional care. Cervical sprain strains are something that I see in my office every day as a doctor of chiropractic. Many times people who suffer from cervical sprain strains have what is called joint dysfunction. That means that the joint is not moving properly. And this can occur in any of the joints in the cervical spine, in the thoracic spine, in the entire shoulder complex, even the jaw, which is known as the TMJ or the temporomandibular joint. So these are all joints that I will evaluate when someone comes into my office if they have suffered a cervical injury. The main treatment performed by a doctor of chiropractic is what is called the chiropractic adjustment. The chiropractic adjustment helps to restore proper joint motion. That will help to eliminate the joint dysfunction. The chiropractic adjustment can be performed to any joint in the body. When someone has a cervical sprain strain, obviously the treatment would be concentrated on the cervical spine, the thoracic spine, the shoulder complex, and the TMJ if needed. There are numerous things that you can do for prevention and rehabilitation as self-treatment for a cervical sprain strain. You always want to think about prevention. First of all, you have to check your ergonomics. Is your workstation set up properly? Are you in a good position when you're driving, when you're sleeping, when you're using electronics, especially the cell phone? Many times when we are on the cell phone, we are in a position like this. The neck and the upper thoracic spine are bent forward. You want to be in a good position, keeping the thoracic spine straight and the cervical spine straight, and bring the phone up to your eyes. This will help to prevent any excess pressure on the cervical spine and the thoracic spine. Stretching the neck muscles is extremely important. The general guidelines for stretching, when it has to do with the neck or with any other body part, is to move into the stretch slowly. Hold a mild, comfortable stretch, and then move out of the stretch slowly. When you are stretching the neck, the stretch should be held anywhere from 5 seconds to 20 seconds. You do not have to hold a stretch in the neck as long as you hold a stretch in other body parts. So 5 to 20 seconds is usually a good time to stretch the neck for. Again, the duration does not have to be long when stretching the neck muscles, anywhere from 5 to 20 seconds. And use the general stretching guidelines. Move into a stretch slowly, hold a mild, comfortable stretch, and then move out of the stretch slowly. If any exercise, if it is a stretching or a strengthening exercise, elicits symptoms or intensifies symptoms, you want to stop that stretch or exercise immediately. Never perform a stretch or strengthening exercise that elicits symptoms or intensifies symptoms. If this is the case, you want to stop immediately. Then try to perform again by modifying that stretch or strengthening exercise, or completely skip that exercise and find a viable substitute. One of the tools that you can use for a cervical sprain strain is what is called dynamic range of motion exercises. You want to move the neck in various directions and positions. You move it slow in a controlled manner through a pain-free range of motion. And what I mean by that is, for example, say I'm bending my head to the left. And when I get to here, if I start to feel symptoms, then I want to stop right before that position. I don't want to move into pain or symptoms. So you stop right before you get to that position, and you move into that position slowly, and then you move out of that position slowly, and then you could perform in another direction, and you could perform another motion. When you are performing dynamic motions, you can perform them for the cervical spine, you can perform them for the shoulders, all the different joints in the shoulders. You can perform them in the rib cage. You can move your shoulder blades on the rib cage. You can perform thoracic spine motions. This will help to prevent and to rehabilitate a cervical sprain strain. The next thing you want to think about is strengthening exercises for the neck. Performing strengthening exercises should be started with what is called isometrics. Isometrics are strengthening exercises where there is no motion involved. You want to use mild pressure when performing isometric exercises. You want to make sure that you find a position that is comfortable and you push against your hand. For instance, I'm going to be moving to the left. I can start in any position in left lateral flexion. Right now I'm in the neutral position. I place my hand right here and I apply mild pressure. I'm not pushing against my hand, I'm just resisting the motion. And I move my neck into my hand for 2 to 6 seconds. Start with 2 seconds and build to 6 seconds. Isometrics are a fantastic way to strengthen the muscles, especially if you have a limited pain-free range of motion. Once your pain-free range of motion increases, then you could start performing what is called isotonic strengthening exercises. Isotonic means that there is a motion. It would be the same thing I just demonstrated. Just say we're moving into left lateral flexion. And instead of just holding here, I would start at a position where there is no pain, and then I would slowly move through a pain-free range of motion, providing resistance, and then moving back to the starting position and repeating the motion. And you can do that in all ranges of motion. Like I stated before, always work through a pain-free range of motion. If any exercise elicits or intensifies symptoms, stop immediately. You are preventing and rehabbing an injury. Work at your current level. Do not try to do what you did before an injury. You have to realize that it will take time to get back to where you were before the injury. Another thing when you are performing strengthening exercises is that you want to strengthen the surrounding muscles. This will help to strengthen the cervical spine. Many times, if the upper thoracic spine is weak, it puts additional pressure on the cervical spine and a greater demand on the muscles and the joints in the cervical spine, which lead to injury. So you want to perform thoracic spine strengthening exercises. You also want to look at strengthening the shoulder, especially the posterior aspect of the shoulder. Thank you everyone for viewing today's episode of Dr. Ozello Sports Medicine Report, where I covered a cervical spine sprain strain. This is some basic information that you can use to prevent and rehabilitate a neck injury. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you can get additional information on my book, and you could also find my blog there. My blog contains articles on sports medicine, spine health, fitness, and health. Please feel free to like this video. Also, if you have questions, feedback, or suggestions, please leave them in the comments section below. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC, and always remember to train hard, train smart, get adequate rest between training sessions, utilize nutritional and supplementation strategies that work for you, stay injury-free, and accomplish your goals.